So my name is Glenn Gibson. I am a Professor of Microbiology at the University of Reading in the Department of Food and Nutritional Sciences. A prebiotic is a fertilizer in simple terms, so it's something that stimulates positive bacteria, but they were generated for the gut microbiome and the roots of using diet mainly to increase the levels of positive microbes already in the gut. All fibres are not prebiotics. Hitherto, the prebiotics which are most researched are fibres, but not all fibres are prebiotics. And the difference is that prebiotics have to be selective in their metabolism, so they have to confer an effect upon the positive components of the microbiome. Many fibres are more generally fermented or broken down than that, so they don't have the degree of selectivity that is required of prebiotics. Like probiotics, like antibiotics, all prebiotics are not the same. So there are different prebiotics out there, but the most extensively looked at are FOS and GOS, and they're different. They both confer positive effects upon the gut microbiome, but maybe in different regards. And it's the same for pro and antibiotics, as I said. Different versions have different effects. I think prebiotics can change the gut microbiome because basically you're playing with what's already in there. So a probiotic is a live microbe which goes into the microbiome. It's a strain of microbes or a collection of strains or species. So I don't think it has a profound impact on the overall composition. But a prebiotic is metabolized by what's in there in the first place. And prebiotics tend to stimulate groups of bacteria, also called genera or genus of bacteria. And so if you take something like GOS, galactoligosaccharide, that stimulates bifidobacteria as a group of microbes, not just individual species or strains. So I think prebiotics can impact upon the overall community. Prebiotics support digestive health by boosting beneficial microbes mainly in the large intestine, and then they have a concomitant effect upon gut health, either by their physical presence or their elevated physical presence. We know that certain cell wall structures in microbes like bifidobacteria have anti-inflammatory properties. They've been looked at in terms of eczema and asthma in children in this regard. But also bifidobacteria are very powerful inhibitors of pathogens, and so you get decreased rates of infection. That has implications for acute infections like gastroenteritis, but also has implications for infections that cause long-term difficulties like IBS and IBD. In terms of gut health, when prebiotics boost beneficial populations, their products, the products of those microbes, can then have influences upon cardiovascular health, immune health, weight management type issues, cognitive function. But also in a more direct manner, prebiotics were first originated for their effects in the gut, but now they are being applied to other ecosystems like the oral cavity. The whole area of dental caries, gingivitis is being researched, as is skin health, things like eczema, acne, for instance. So any community that has a mixed population of microorganisms is susceptible to a prebiotic approach to try and drive up the beneficial communities. However, because these microbiomes have different indigenous microbes belonging to them, the type of prebiotic that you would use for oral, skin, and gut health probably differs. Dysbiosis means the same as really dysfunctional. It's where the gut microbiome isn't acting as it ought to. And a lot of this relationship is actually driven by diet, because people have said in the past, we are what we eat. Our microbiome is also what we eat. And depending on whether we have a diet which is positive or negative for our microbiome, there will be health consequences as a result of that. And what we don't want to happen is dysbiosis to occur on a long-term basis, of course, because that will lead to chronic issues like inflammation. So within the gut, if dysbiosis occurs, that means levels of pathogens, which are negative microorganisms, are higher than they should be. So they can kick out toxins, they can begin to invade gut cells, and these all cause real problems which are manifest as things like diarrhea and sickness. On a more chronic basis, dysbiosis is characterized by levels of inflammation which are higher than they should be, and this predisposes towards disorders like inflammatory bowel disease, for instance, ulcerative colitis and Crohn's disease. So this whole area of gut dysbiosis needs to be well managed. It can be managed by pharmaceutical approaches, but what we would obviously prefer to happen is that we deal with these issues before they occur. And nowadays there's a great deal of interest in trying to use diet to mitigate against gut dysbiosis. So we live with our community of microorganisms. There are trillions and trillions of them there. So, humans are the ultimate hotel, if you like. And so what we need to do is to really treat these guests as much regard as we can and help them to maintain our homeostasis, which is our normal bodily function, our ability to ward off infections, etc. So they will do that to some extent, but if we can help the relationship along, that's obviously of benefit. The role for prebiotics is, I think, generically the same as probiotics. The overall areas of obesity and weight management and the concomitant risks associated with that, as well as cognitive health. I think this area of gut-brain is absolutely fascinating. So those are I think are the ways forward for prebiotics. And then we'd have the more traditional routes of trying to repress rates of infection. And of course, given what's happened in the last year and a half, viruses very much come to the forefront in that regard. So long-term conditions can be managed by prebiotics, but kernel to their effects is stimulation of beneficial microbes in the gut. And whatever those microbes do after that, by their physical presence or their products, their function arises because of the prebiotic boost.